All right, good morning, everyone. Good afternoon now, I guess. We're running a few minutes late. Thanks for being here. We're really looking at the end of session and what it's going to take to find compromise and balance the budget and get out of session on time, and I'm still confident we can do that. It seems in the last, 24 hours, we took a step back. We believe we're having good discussions on balancing the state budget. DFLers have been willing to compromise. We have taken some things off of the table. We have moved towards the governor, as you all know, at least 85% of the way towards what he wanted for his solution. And we're looking for a good deal for Minnesotans now in the last few days of session. And we always thought that it was important that we looked at this early MA option as something that would be a good deal for Minnesotans. If I could illustrate it for you very clearly, if we put up $1, we get $7 back of our tax dollars from Washington. It is that simple. Minnesotans, whether they're Democrats, Republicans, or Independents, have always been concerned, and currently we're ranked 46th in the nation for tax dollars that we receive back, that we send to Washington, that we get back. For every dollar we send to Washington, we get 72 cents back. That's been a concern of Governor Plenty. That's been a concern of the legislature and Minnesotans in general. This early MA option would bring more money back to Minnesota that we send out there. What do we look? And I just want to throw out a few more numbers here. What we're looking at: 22,000 jobs are on the line with this. $1.4 billion coming to Minnesota from Washington, and coverage for tens of thousands of Minnesotans. We always thought this was a good compromise as well because Republicans have been for this in the past. Last year, Representative Gottwald offered an amendment basically taking folks from a state program and having the federal government cover it. That's, in essence, what this MA option is. He said it would be a pretty easy fix. Representative Zellers on NPR just this January basically said the same thing, that this was an easy solution that the Republicans brought forward to take this population and move them over to the federal program. And that's what this is. I think we are now at the point where it's more about politics than it is about policy, because the policy remains the same. After federal health care reform passed, Minnesota was put into a position where they could do this move, and it's going to help our hospitals, our doctors, and it's going to start to bend the cost curve for Minnesotans with health insurance. So the policy hasn't changed, but it seems like the politics at the Capitol have changed. Some of my Republican colleagues who have supported this last year and even earlier this year with Representative Zellers on NPR have now stated that they don't want to do this. And that baffles me to some respect, that the politics has changed even when the policies remain the same. This makes great fiscal sense because, as I said before, I mean, this is the easy way of looking at it. But the real numbers are $188 million we put up. We get $1.4 billion of our own tax dollars back from Washington. So that ratio is for every $1 we put up, we get $7 of our tax dollars back to Minnesota. And that's a good deal. And that money goes right to our hospitals. And whether you look at the GAMC fix that the governor really fenced out rural Minnesota and rural hospitals, that problem would be solved in this bill. I know the governor vetoed this proposal, blamed the surcharges on it, and I think we need to have the surcharges sit off to the side for a moment. We can have that debate on how best to finance this proposal, but when you look at the proposal on its face value, I just don't understand how you can be for it one day and be against almost the identical proposal the next day. And so I'll turn it over to Chair Huntley and Chair Thiessen to deliver some more comments as well.
Well, I'll be brief. The money, the $1.4 billion that we would get from the feds for $188 million of our money doesn't go to poor people. It goes to our hospitals, it goes to our doctors, it goes to our nurses. Hennepin County is already, hospitals already laid off 200 people because of the cuts associated with the GAMC bill. Shifting this same group of people from GAMC into medical assistance that are already covered by a state program. There's very little expansion in terms of the number of new people. It's people that are already on GAMC or already on Minnesota Care that would move over to MA, and that would allow us to send a lot more money to our hospitals and to our doctors and to our nurses. They are severely underpaid right now for what we pay for our public programs, and this would allow places like Hennepin County Medical Center maybe to hire back those 200 people they had to lay off. So it's jobs in Minnesota, it's improved health care for everyone, and it is really not expanding government programs.
Well, just two quick points more to make on this. And the first thing is that we have been doing this as part of our healthcare programs, that is drawing down Medicaid dollars, getting the 50% match for 40 years. There's nothing new in this proposal. This is not the mandate that people complain about. This is not a business tax. There's no privacy concerns related with healthcare reform. This isn't the federal healthcare reform bill. This is something we've been doing in Minnesota for 40 years, and we're just applying the rules, which other states are already getting the opportunity to do, including our neighbor in Wisconsin. They're already getting paid for these single adults under a waiver they got a while ago. This is just Medicaid program applied to a little bit of a new population. It helps Minnesota. So the argument that is made that this is buying into federal health care reform is simply false. And the other thing that's really important is that the difference between doing what we could do with the early option and what we're going to do under the current GAMC program, the status quo, the main difference is that we're actually going to pay hospitals and doctors a reasonable amount for the services that they provide. And why the Republicans are opposed to paying doctors and hospitals a reasonable amount for the services they provide, I really can't understand. So I think it's really important that we keep these facts very clear, that this isn't federal health care reform. I mean, they like to lump it in with Obamacare, as they call it. It's not that. This is something we've been doing for 40 years. This is paying doctors and hospitals a reasonable amount of money. That's where most of the money is going to be spent on, and that benefits every single one of us. And Republicans voted for this, promoted this, proposed this exactly this time of year last spring. This exact proposal was on the table in an amendment that they offered, and so to be switching their position right now, there's only one explanation, and that's politics, and that's not good for Minnesota.
And if I could just sum up, I think Representative Zeller's actually put it best. January 8th, as I said on Midday on NPR, he and I think many of the press have the transcript. If you do not, our press folks can get it to you. He said that this just makes sense to take folks from a state program and merge it with the federal program. It saves costs and cuts down bureaucracy. Why wouldn't we want our tax dollars we pay to Washington to come back to Minnesota? So I agree with Representative Zellers. I agree with Representative Gottwalt and the House Republicans who proposed this last year. I just don't understand. I mean, they voted against our solutions we've offered all session. They voted against the governor's solutions all session. I would hope they wouldn't vote against and not support their own solutions that they have offered. So I think this is the way we can go to end the session. This is, as Representative Thiessen said, a solution that was brought forward by Republicans last year. The policy remains the same. We actually get a better deal than we did last year because more tax dollars of our own coming back to Minnesota. It's good for our hospitals, our doctors, for Minnesota families and their health insurance, and it just makes perfect sense. If we can get agreement on this, I think we can get to the end of session. Questions?
So this is a must-have as part of your final package?
Well, I think it's a must-have for Minnesotans. I think we should not squander this opportunity, as I said before, to get back more of our tax dollars from Washington than what we put in.
Mechanically, Representative Thiessen, when would the early enrollment actually start if this was passed this weekend?
The proposal in our bill is July 1st.
And does the amount that the state could receive drop off dramatically if it is delayed until next year, perhaps during the legislative session of 2011?
The longer we delay it, the longer we wait to get the federal match. So, it's kind of there's a monthly amount that we would lose.
Do you have a sense of how much that is?
I don't.
Well, you'd have to divide it by the 1.4 million by that's over the 3-year period.
And just a sense of how many people would this affect on July 1st?
We currently, at any given time, we have 35,000 people on GAMC. Over the period of a year, that goes up, and the forecast we have is about 80,000 people would move from GAMC and from Minnesota Care into this program. And there would be an additional 20,000 that are eligible for those two programs but haven't signed up, would be incorporated in there.
And that 80,000 is one time, or are you talking about over a year?
It's one time. So it's
So
30.
over a year, how many people are we talking about?
Well, probably more than over 100,000 that would kind of come in and out. I mean, the GAMC we know about there's about 35,000. That would probably be about 70,000 over the course of a year, and then there's a Minnesota Care population that's about 40,000, and that would probably be not as much turnover there.
And Representative Sertich, when the Republicans come out last night and now describe this as Obamacare, in which they do not want to participate, using that word, what does that do here to the dynamics and the tone?
Well, I think using that sort of rhetoric puts into politics too much what is good policy. This is their own proposal, and they have now renamed it and are now against it. And that's what's unfortunate. I just want to go back to what Representative Thiessen said. We have to separate what's happening in Washington and what's going on in Minnesota right now. This is a House Republican proposal that we're putting forward to try to end the session and have a good deal for Minnesotans. And to interject politics with that rhetoric is not helpful because it goes against what the Republicans offered in the first place. And it's not necessary. I mean, the only thing that has changed since last year, the policy hasn't changed. The politics has just changed. And I want to recap here now. We're in the last few days of session. As Democrats in the legislature working with the governor, we have compromised on 85% of the solution. Governor's getting about 85% of what he wants. Now, I know this guy, and I know most people try to get 110% of what they want. That isn't fair. Minnesotans know that.
Are you willing to walk away?
We're not walking away. We're here working at the Capitol. The only way we go to a special session, Pat, the only way we go to a special session, I think, are if House Republicans stick to their position today, being against what they proposed.
Well, let me rephrase that. In your view, are you willing to support or walk away from this if it means protecting these people that you want to protect, moving them from one to another?
Pat, it's not about protecting people. This is about making sure that our hospitals get paid. It's about saving jobs.
And poor people for health care.
That's not what this is. Pat, that's not what this is about. This is about protecting jobs. This is about protecting our hospitals, especially our rural hospitals. This is about making sure that Minnesota gets a good deal from Washington and gets our tax dollars back.
This was such a good idea. Why did you all vote against it when Representative Godwall came up with his amendment last May?
I believe it was actually adopted at the time.
We actually all voted for it. There were maybe 2 audible no votes. I offered the amendment as well, and that was passed.
So it did pass last year?
It passed the House last year, and then
what happened to it? Lost in confidence?
It didn't. The bill just didn't make it through the process. Mm-hmm. But so it's actually not just that they offered this; they all voted for it as well.
If I could just add one thing. Representative Dean was asked this morning when we were in consulting with the governor's people why he supported this last year and does not support it now. And his answer was, the world has changed.
Representative Sertich, given the attention that this issue has gotten over the past few days, can you bring us up to speed as to where the broader budget discussions are? And you seem to suggest that the governor is going to get much of what he asked for. Then what's the remaining sticking points there?
This is one of the major sticking points. On the budget side of things, we as Democrats are ready to lead. We have voted for significant cuts in state government. We have voted for reform measures that are going to improve government. We are now bringing to the table a bipartisan proposal that has been supported by Democrats and Republicans alike to get through the end of the session. And it would be unfortunate if the rhetoric and the politics gets in the way of a solution here to end session on time. We've asked Governor Plenty to come home. We're glad he caught a couple of fish this morning. He should jump on the plane and get back home. Because I was supportive, as you all know. I've been very public about making sure that we keep that tradition of the fishing opener. In these days and times, he's able to jump on a plane and maintain his commitment to that northern community and be at some events. But now's the time to come home and get the job done and show leadership and get us all together. What I would hate to happen right now from either the governor's office, who earlier this week said he was open to this proposal, and he should be because it's a bipartisan proposal. What I would hate for right now is for this to get caught up in two respects. Representative Thiessen hit on the first one. If people try to take national politics, Tea Party politics, and bring that into the discussion, because that's not what we're talking about. We're not talking about the mandate. We're not talking about what's going on in Washington. We're talking about a good deal for Minnesotans and getting their tax dollars back to Minnesota. We're not talking about expansion. We're really talking about what Representative Zellers and Gottwald talked about last year, a good deal for Minnesotans. And so if we can get this done, if we can get this agreed to, we can get done on time. So I'd encourage all legislators and the governor to look at what they've said in the past, look at what they've supported in the past, and realize that this is common sense, this is compromise, and this gets us done on time.
So is this the only thing you're trying to negotiate right now? You're not trying to do the school shifts or cuts or anything? This is it?
Well, Don, we're working on the details of that as well, and we're actually making progress. If you all remember, we passed about $700 to $800 million worth of cuts in our balanced budget. Governor vetoed the revenue in that bill, which was unfortunate, but we're moving on from that, and we're trying to find compromise there. I know in my heart whether the Republicans come on board or not to the cuts, we're going to lead and we're going to make the tough decisions. You know, last night on the phone with the governor, he said that one of his litmus tests now is to see, he wants to make sure that a handful of Republicans support these proposals or else he's going to be against it. And I think to hold up our state budget and to hold up this entire legislature for a handful of minority members is unwise. That means we would let just a handful of people eventually drag us into special session. And that's, I don't think, what we want, and I don't think anybody wants that. Minnesotans certainly don't want a special session. I don't think we need one. So we're gonna lead. And we told the governor flat out, if the Republican minority is going to continue to vote no on our proposals, continue to vote no on the governor's proposals, and it sounds like even continue to vote no on their own proposals, we're willing to lead. We just want to get this done.
What's the status of the negotiating meetings, and have you been told when to expect the governor to return?
We haven't been told. He was fishing this morning. It's probably about an hour to 2 hour plane ride or less from International Falls, so we're ready to meet when he gets back to town. We hope it's sooner rather than later because we want to get done tonight.
Senator Vogelmiller suggested last night that they would take up a bill that was exclusively the cuts part of the package that you guys passed over the week. Is that something the House is planning to do as well today, no matter whether there's agreement with the governor or not?
We will pass a balanced budget again, and with those cuts to the governor, if that's necessary. What we want is an agreed-upon solution, but we have to get done one way or another. And if the governor's not here, if the governor's unwilling to compromise, we still will finish our job on time.
We have revenue in that package?
No.
So you'll have just cuts and school shift?
We will pass the cuts that we've passed in the past.
What's the House position on this second bonding bill that the Senate Finance Committee is working on today?
I don't believe there will be a second bonding bill.
what are you guys going to be doing between now and the next day to reach out to Republicans?
Here it is. This is their proposal. We are coming forward with their proposal to say, please support your own proposal. I don't know what else we can do. I think we are going above and beyond by offering their own proposals as the solution to end this session. And so I don't know much else we can do besides bake them cookies and give them milk. I don't know what else. But we are now offering their own proposals to them as a solution to the end of the session.
Have you sat down with Zellers or anybody else to talk about this? You as a leader?
Not yet. He actually just showed up at the Capitol minutes ago, and I would just assume his position wouldn't have changed since January 8th when he thought this was a good idea.
Is it good to assume?
I take. Well, let me put it this way. I take Representative Zellers at his word. If it was a good idea then, it should still be a good idea now. Nothing has changed since January. All right. Thanks, everyone.
Grandson get dedicated in Denver, so unfortunately I won't be able to be part of this.